According to new research, it may really take a village to keep a child safe from homicide.
Youngstown statistics and advancements were looked into for the study, and it turns out we may have been thinking ahead. 27 First News reporter Molly Reed dug into what this means in keeping our teens safe.
A new study by the Journal of the American Medical Association Pediatrics found links between environmental elements and adolescent homicide rates. Researchers studied 143 homicide cases involving adolescents ages 13 to 20 in Philadelphia between 2010 and 2012. They found that the presence of streetlights, illuminated crosswalk signs, and public transportation were tied to a lower risk of teen homicide. On the other hand, sites that had stop signs and security bars on homes showed a higher risk. YSU criminal justice professor Dr. Richard Rogers says this is something Youngstown has already been working on.
We're actually going through all of that data, and what you're generally saying is true, that bad crimes tend to concentrate in bad areas.
In 2015, First News reported on 26 incidents that police investigated as homicide. Youngstown's first murder victim of 2016 was just 23 years old. Dr. Rogers told me that the city already has specific addresses where this violent activity is particularly high.
In lots of communities, when they look at broken windows policing, those things do keep coming up repeatedly.
Although he believes there is a tie between the neighborhood elements and homicides, he doesn't think it's the only cause.
We know that those relationships exist, are sometimes effective, but you can also point to places where they're not effective.
Natalia Payne, Senior Vice President for Research and Operations at Child Trends, told me this study is particularly interesting because of its impact with teenagers.
The factor that we know about in teen brains is that they do not estimate risk well, and that the upside of things and that contagion around the upside of things is so much more powerful.
Although she believes there is definitely a need to do more intervention studies to test teenagers, she feels this is a good start.
Having a light that's out, it might be just enough to swing that teen's decision-making in that moment.
Reporting in Youngstown, Molly Reed, WKBN 27 First News.